My name is Marco Bosquez. I'm one of the sports medicine physicians at Orthopedic Associates of Central Texas. In sports medicine, it's a broad spectrum role here in the clinic, anything from evaluating acute injuries to treating joint pain, muscle aches, strains, stress fractures. We do a lot of injections and other diagnostic testing to make the correct diagnosis for our patients. Anybody really that has an acute injury or a new injury, anyone with chronic pain to a muscle, tendon, joint, bone, anyone who wants to talk about the advantages of exercise through the course of their life, anyone who needs information regarding return to sport or activity after an injury, or anyone who needs diet or other counseling regarding overall wellness and fitness. Trends, they come so fast. The latest trends, I think nowadays, are more toward minimally invasive surgery and decreased OR time and decreased hospitalization stays to improve patient pain and improve outcomes. OACT is a full spectrum orthopedic clinic. We offer almost every single subspecialty from foot and ankle to general orthopedics, shoulder subspecialization, spine, and non-operative spine and non-operative sports medicine. The different specialties offered by OACT run the full spectrum of musculoskeletal and orthopedic care, including spine surgery, foot and ankle surgery, general orthopedics with emphasis on joint replacement, as well as arthroscopic surgery, non-operative spine, and non-operative orthopedic care. I think what makes Orthopedic Associates so different is the full spectrum of care offered by our group, as well as our goal of being a one-stop shop, in the sense that we offer multiple different diagnostic modalities, including EMG, MRI, ultrasound, fluoroscopy, as well as physical therapy. Because we offer a full spectrum of care, we offer same-day appointments, we facilitate patient involvement in physical therapy as well as home health care, and we offer full diagnostic modalities and diagnostic imaging in-house. In my practice, I treat an awful lot of children and young adult athletes, and so the most common cases that I see are typically new injuries or acute injuries suffered either while working out, exercising, or through participation in sports. I love treating children. I have 4 kids myself, and I find offering advice to parents and children very rewarding. The most challenging aspect of treating a child is treating the parent, I think. Children overall do very well with their pain and understand a lot more than we give them credit for, but in most cases parents may feel a little nervous, they may feel a little guilty, or they may need more education regarding the child's return to sport or other activities. The main goal in treating a patient is always care centered around the patient, to reduce their pain, to make the correct diagnosis, to facilitate treatment that is appropriate for that patient, treatment that is pain-free if diagnostic testing is needed, and to facilitate the return to an active lifestyle or to the sports field. I think I provide the best service to my patients by being available. Access to care is extremely important, and we do our best to get patients in that same day or at the latest the next half day. But access to care is only part of it. I think the other part that's important to patients is making an accurate diagnosis and beginning treatment immediately. I connect to my patients in multiple different ways. As a father, as a husband, as an exerciser, I think I cover most roles that patients will encounter. Being given advice to a patient regarding the care of their child, I give advice as if that child was my own. As a husband or as an active person, I give advice regarding what I would tell someone if they were in my family or friend. And if there's an elderly patient involved, I give advice regarding how I would care for my own parents. To be fellowship trained really means that you've done additional post-residency training, specifically in the field you're going to practice in. It gives us a time to learn more current research and more current treatment techniques. Choosing sports medicine was actually very easy. I've had a lifelong interest in sports and I enjoy exercising tremendously. Not only that, I think the human body is an incredible machine. I also find it very important to be a good example for my patients. When they're coming in for advice or they're coming in to be treated, I think it's very important as a physician to be able to point to yourself as an example. The most common procedure I typically perform in the clinic is going to be either an injection or treatment of a closed fracture. Keeping up with the current technologies in medicine is extremely challenging for any physician given the busy schedules that we all keep. However, we attend numerous meetings throughout the year and go to any local lectures we can so that we can keep up to date on current technologies and treatment patterns. I'm married to another busy physician in the community. We have a son, a daughter, and 2 twin boys. We have numerous interests. Our oldest son loves art and music. We love food. We try to spend a lot of our time outdoors, including some hiking, some bike riding, some swimming, and recently begun to relearn the joys of hunting and fishing.